My name is Mohamad Koubeissi. I'm an epileptologist from George Washington University. The symposium is tailored in a way to maximize the knowledge of the new as well as the established imaging modalities that are used in the treatment of epilepsy. The goals are to familiarize the audience with the technical ways and reading ways to maximize the quantity and quality of information extracted from neuroimaging modalities, whether it's structural or functional neuroimaging. The session included a talk on the seizure protocol MRI, which I think is extremely helpful for clinicians taking care of persons with epilepsy everywhere, because there are certain sequences that may reveal abnormalities that are epileptogenic, but these may be missed by specific techniques or sequences or thickness of the cut if it's not optimal. So that was probably very, very useful clinically. The sessions on the functional neuroimaging are also essential because now they are, the PET and SPECT scans are being done at most, if not all, epilepsy centers. So again, familiarizing oneself with the techniques is essential, and especially interesting is the glimpse on the future molecules that are going to be used to help us use PET and SPECT for, again, to extract more information about the pathophysiology of epilepsy as well. The new MRI techniques, which was the last talk in the symposium, was specifically fascinating as well, both in terms of looking at the anatomy of the gray and white matters, and in terms of studying connectivity and between different brain regions. I think that session probably for the first time mentioned pixel-based morphometry, fibers within the voxel, specific analyses that again help us extract more reliable information about white matter tract connectivity. Again, as I mentioned, the seizure protocol MRI and whether it can be standardized in terms of the sequences, the magnet, and also the thickness of the cuts. This is probably one of the very variable things amongst institutions, and I hope the session helped clarify the strength and weakness of different types in a manner that may attempt to unify the protocol among practitioners. That was something very important. Also, like I said, the functional neuroimaging studies may help propagate the use of these technologies at different centers, both for clinical and research purposes. I didn't mention the EEG with fMRI part, which has been used for research purposes for a number of years now and has yielded beautiful information and insight into the pathophysiology of epilepsies, but more and more it's evolving to become a clinical necessity.